Hi, this is Rob Packard from Medical Device Academy. Welcome to our live streaming on Friday afternoons. Every Friday at 12:30 Eastern Time, we have another live streaming. Today almost didn't happen, but fortunately, Green Mountain Power hooked us up and we have power today, just a little bit before the session. So sorry I'm a couple minutes late. Today's session, we're going to talk about what is the status of the 510K course, because we've been updating the 510K course that we sell on our website, specifically for the new eSTAR template. The FDA, a little over a year ago, released the 510K eSTAR template as a new way of submitting the 510K submissions in de novo submissions. So it's for both types. They also have a separate template that you can use for IVD products. So one for devices and one for IVD products. But it builds on the PDF format or Adobe PDF, and it organizes everybody's submission the same way. So it's much easier for the reviewer at the FDA to identify where your content is. But the way the 510K eSTAR is organized and the de novo eSTAR is organized is different from the way things are organized if you're doing a traditional 510K with the 20 sections. So should you switch? Absolutely. The reason why? Because as of October 1st, 2023, you will only be able to submit using the eSTAR templates. So you have approximately 10 months or 9 months to learn how to use the eSTAR template and convert over to that process. So we're in the process of converting all our videos over to explain step by step, page by page, how you do this. And how far are we right now? We're about halfway. This week, yesterday, we finished the labeling section. The next section is going to be the reprocessing section. We'll be recording that not next week, because next week we take a week off for the holiday. The next one will be on the 5th of January. So 2nd, 3rd, 4th, 5th. Yeah. So the 5th of January will be our next live webinar that we do. And it's live for the people that subscribe to the 510K course. So you're seeing this on our free YouTube channel, and it's a live streaming. But we also do live webinars where you pay to get access to it. And so only subscribers to the 510K course get that. Some of my videos, like this one, I make live and available on the free YouTube channel. But a lot of the content, probably most of the content, is available for pay if you subscribe to our 510K course. We started out before even the eSTAR existed, we had 36 plus videos. Now we've been adding one a week, and we won't be finished until March. So you're looking at maybe another 10 or so videos that we have to complete to finish the entire process. The last one, I believe, was number 7 or something in the series. So we're not quite halfway, but we're around that halfway point. And we're going to have maybe 1 or 2 more weeks that we're going to miss for various trips that I have to do. But we're expecting to finish somewhere around, actually, I take that back. It might be April that we might actually be finishing. So that gives you an idea of the timeline. So if you want to have an opportunity to talk to me live and actually listen to some of the other people on our team, because they usually participate in the calls as well, you can ask questions specifically about 510K submissions. You can ask about the section that we're dealing with specifically on that day. You can watch the recordings if you can't participate in the live. And you get access to all of our templates. So every single time I go through one of these, if I see something, oh, this needs to be fixed in our template, I fix it then. And then I introduce that this is the change that we made to our templates. And I show people how to go find the information that they need to fill in these templates. So if you're preparing your own 510K and you want to prepare one, it's going to take you months to prepare that because you prepare it in parallel with your actual testing. Now, yes, you could do it all at once after your testing is done. We actually had somebody, one of our clients in Nova Scotia, they contacted us and they said, we want to buy your course. They bought our course. And then they came back to us and they said, we had hired a consultant prior. They helped us with our 510K, but we weren't successful. We bought your course. We were able to do the whole entire 510K ourselves in 2 weeks, and we submitted it to the FDA. And now we have an AI request, and almost everybody does have an AI request, They had an AI request from the FDA asking for additional information. That's what AI stands for. And they said, can you help us with that? So we're helping them with the AI request. That'll be going in later today. And then after they have the AI response sent into the FDA, they have about 30 days before they have clearance of their device. So this helped that company save a whole lot of consulting work because they were able to watch the videos and use the templates that we provided and submit their 510K. So that's one option for you. But you might just be having trouble with a certain section. You might have a regulatory team that you're trying to teach and have the same method that everybody uses. You might be looking to what does Medical Device Academy do differently from the way they do, even if it only helps you in a couple of sections. Just improving your technique and the way you approach your submission just for a couple of sections can really make a big difference in getting your product to market faster. And product to market faster can sometimes be hundreds of thousands or millions of dollars to certain companies. If your company doesn't have a lot of budget, a do-it-yourself way to go is a lot easier. And if there are certain things you can't do, we're more than happy to help you with the pieces you're struggling with and give you hourly consulting. And if you decide instead you want us to do it all for you, that's fine too. We have clients that ask us just to please take it over and please do it for us. We do that as well. So one of the things that is also going to be coming very, very soon, probably in like the second or third week of January, over the weekend of the 7th and 8th of January, I'm going to be working with my son editing a video. In the past, we've gotten a lot of leads from our YouTube video on 510K course. On how to do a 510K, how to prepare one. And so we recorded those with Joe Hage. Joe Hage is at his company is Medical Marcom. I forgot the URL, but anyway, Joe Hage has a networking group that was on LinkedIn, and now he has weekly sessions. He has a Slack channel, and a lot of people in the medical device community globally participate in that group, and we share ideas. Well, Joe would do weekly sessions where he would promote different topics, and he would have a guest speaker. And one of the topics that we did 2 or 3 times was how to prepare a 510K. Well, we posted those videos on YouTube. Joe was kind enough to help me with that. And we would have people say, oh, I saw your video on YouTube. Well, we need to really update those videos because the content that is required for a submission has changed dramatically now that we're doing the eSTARs. So we need to re-record that stuff. So that's one of the purposes of this video, is to point out some of the differences between the way we used to do it and the way we do it now, so people understand what they're getting into. Oh, it's just an eSTAR. What's different? Don't I just still have the 26? No, there's a lot of changes. Number 2, we wanted to take the opportunity to answer some of the frequently asked questions that we get related to 510Ks. So the topics that we're going to be covering are what's new with the 510K submission process, and number 2, what are the most frequently asked questions that we see from people related to 510Ks. So that's what we're going to be answering. If you have any suggestions, any questions you want us to ask, please put them in the comments below. And I'm going to take the best 20 questions and I'm going to put them in there as frequently asked questions. And we're going to indicate what are the differences between the way we used to do things in the older videos and the way we're doing it now using the eSTAR. Because it is a big improvement and a big change for us. So in a nutshell, that's what we're doing with the 510K course. We're updating all the videos. We're not quite halfway through, but we're about halfway through. We've done 7, I think, or we're starting our 8th one coming up the week of the first week of January 5th. That will be on reprocessing. Each week we're going one more step closer to the end of the eSTAR template. We're recording those. We're putting them in our Dropbox folder that we share with anybody that subscribes to that course. In that course, there are tons of folders. Some of them are empty because we haven't recorded the video yet. But as we fill each one, we number them in the order that we're recording them. And if there's related old content that isn't obsolete, like last week, we had how to prepare the label, how to prepare the instruction for use. That's not obsolete. How to prepare a UDI, do you need it in your submission? That was all addressed in a previous webinar that we did. So we kept that, and now we're just showing what additional information do you have to include in the eSTAR templates. And there definitely is some new information that you have to include in the eSTAR templates. One of the things they ask on labeling, they want you to tell them where the legend can be found for any symbols you used. Another thing they want is for you to attach the labeling of all the different levels of packaging. Another thing that they want you to do is to tell them where they can find the indication for use in your instruction for use. So those are examples of things that they have in labeling. And we went through all the requirements for labeling and showed you with screen captures. So there's lots of screen captures, lots of practical examples of how to do this and where to find information in the course. We encourage you to do that. And one last important thing, on January 1st, we're going to be bumping up the price again on our 510K course. So a little while ago, we increased it from $995 to $1,095. The reason why we increased that is we have so much more video content that we're giving people, and we thought it was only fair to charge more for the more content that we're giving to keep it competitive. So we bumped it up $100, and we're going to bump it up again $100 on February 1st. And then we're going to bump it up again on March 1st. And then I think April 1st is the last bump up. So it'll be at $14.95 at the end. So if you want to get in at a lower price, buy now. If you're not sure, you can wait, but there will be a higher price. And we've already had one person say, I waited too long and now your price has gone up. Yep. And it will go up again. So if you're interested, buy before January 1st and you get the current pricing of $10.95. If you have any suggestions, once again, please put a comment down below. This is what I think you ought to do. And because somebody actually did that this last week, they asked for, could you put some more content out there about validation? So this video is supposed to be on the topic of 510Ks and updating our 510K course. But one of the interesting things that we had in a discussion with a client today that's preparing a 510K submission, the FDA in our precept was asking for more information on the validation of software. Now, specifically, this was automated software used internally by the company. Very different. Normally, the FDA says, no, that's part of production. We don't need to see that. But because this interacted with their product, and you have that a lot of times when, for instance, a company has a software tool that's analyzing imaging data, radiological images, and it reviews that data and then spits out a report. A lot of times there's some manual processing of it and creating documents and reports that's done offline and as a service by the company, and then they give that back to the doctor that uploaded the imaging data and asked for that report and that analysis. Well, the FDA is actually asking for, can we see some of that? Normally, they would only look at those things during an FDA inspection, but they're starting to ask for more of that information. They're more interested in cybersecurity. They're more interested in software validation. They're paying much more attention to that. They want to see upgradability and patchability of your software. And the section on cybersecurity is going to be expanding dramatically with the requirement to upload testing. And we're seeing more and more people are having to do a better and stronger job of validating that software. So that's one of the things we're seeing. It's definitely a change. But the things that you should be focusing on if your company has that kind of software, you want to definitely be thinking of the minimum requirements for software used part of your quality system would be the IEC 80002-2 standard. And I know I've had that before in one of our videos. So check that out. We even have a blog about it. It's the IEC 80002-2 standard. And that standard talks about software validation of software used for the quality system. There's also a -1 standard that helps you with risk analysis of software that's used as software as a medical device or software in a medical device. And so that's different from your quality system software. Those two standards are really important. Most people focus on IEC 62304, which is software validation of your software product. But when you're looking at risk analysis of software for your product, that should be driving your validation. The extent of validation in the level of sophistication and the thoroughness and the risk controls you put in place, you're going to want more and more of that the higher the risk of your software. So you need to do the hazard analysis first to determine what level of validation is required. And that's an important step that people shouldn't be forgetting. And so that's what the purpose of the -1 standard is for. And then the -2 is for software quality system. And then the 62304 is validation of the software for the device. So I hope that helps for those of you that are out there trying to figure out what do we need for validation for a 510K submission. There are other things that you need for design validation, like performance testing. There's a lot of verification testing. That's what most of your test reports are. Biocompatibility, sterilization, shelf life, electrical safety, EMC testing. All those are verification. But then you also have the performance validation testing that you do. Oh, if you have any other questions, don't forget to put them down below. Like the other person that asked about, can you provide some more information on validation? That's how you get it. You get some free consulting just by putting a comment down below and say, hey, could you talk more about this? So I'll put it in our next live session if I can, or we'll do a special video just about that or a blog. Hope everybody has a happy holiday. And if you found this video was helpful, or you know somebody that ought to sign up for the 510K course, please share the link down below and have a happy holiday. Bye-bye.